Hello, this is Dr. Stanley Lang. Welcome to this presentation on how to reverse diabetes. And the major question that we're going to talk about in this video is related to a question that one of my patients that I saw today asked was, how long do I follow the program? How long do I follow the program? And the reason he's asking the question is that he's been following this diabetes reversal program that I have for the last year, and he has reversed his diabetes as of the last time that I saw him, which was a few months ago, about 3 months ago. And he's still making progress in terms of weight loss. So it's a little bit of confusing to when do we stop following the rigorous program and sort of back off and take it a little bit easier and be a little bit more flexible in the strategies. So the strategy that I teach and have been teaching for many years, actually more than 20 years, is a program that is a very low glycemic index eating strategy. And it's been my experience that when somebody has actual diabetes or they're very close to diabetes, they're very, very pre-diabetic, that for them to be able to completely reverse their type 2 diabetes, they have to be virtually 100% in following the strategy. And they can't back off in terms of reversing diabetes if they intermittently don't follow the strategy. And now, that's not my rule, that's just my observation. If they don't do that, they don't reverse their diabetes. And this, of course, is integrated with appropriate exercise. But this gentleman had basically had his A1C was 5.4 the last time that I'd seen him. And since that time, he's lost an additional 20 pounds. So he's lost approximately 70 pounds in 1 year and still going strong with the program. But he just was curious as how long do I follow this program? So the answer is, I think that you should follow the program rigorously until you're at your appropriate weight. Now, what we talked about today was that doesn't necessarily mean that you're at your ideal body weight according to some graph, but when you're following a very low glycemic eating strategy that is a healthy one that you can eat the rest of your life, then the body will gravitate towards the weight that you're supposed to be at if it's combined with an appropriate exercise program. Now, you may have some starts and stops. There may be some times when you sort of plateau for a while, but then you'll continue to lose weight, in my experience, if you're following the program closely. And so I told him, as soon as you hit your weight, at that point, you're almost bulletproof in terms of redeveloping diabetes unless you start eating high glycemic foods again in large amounts. So the answer is, you need to follow the program till your weight tells you that you've cured your problem. So the A1C is going to get normalized before your weight is normalized. In every case that I've seen so far of people reversing type 2 diabetes, in other words, the measurable chemistry gets better faster than losing all of the extra weight. But moving towards losing all the extra weight is the goal to make you, in a sense, no pun intended, insulated against regaining the weight and redeveloping diabetes. So I hope this is helpful to you in terms of how long do I follow this low glycemic eating? Well, if you really want to reverse and you want to make it stick, you continue that eating strategy until you're pretty much at your appropriate weight, which is going to be close to your ideal weight, but not necessarily. It might be a little bit above where the weight tables say you should be, and there's a lot of other variables that have to do with how much muscle you have. So I hope this is helpful. Again, the context for this is whole person health, health of body, mind, and spirit. This is the model that I teach my patients, partly because chronic stress is a huge player in almost every chronic disease, including diabetic control, and whole person health strategies automatically diminish chronic stress. Now, if you'd like to have access to a resource that will help you understand a little bit more about what low glycemic eating is all about, you can get a free copy of the Why Am I Still Fat ebook just by clicking on the link either beside or below this video. So I wish you well on your quest for good health, and if you're diabetic, on your quest for reversing your diabetes. God bless and have a great day.